Thank you very much. So we have questions. How can we have a wave when 90% of people over 12 years of age are vaccinated? Does it mean that the vaccine is not as efficient as we thought? No, that's not the case. You should understand that without that high vaccination rate, we would be submerged or snowed under with this wave because the Delta variant is a lot more contagious than previous variants. And clearly, that's the way we're going. Now, the share of the ratio of French people in hospitals is very clear. It is clear that when you have COVID patients admitted in hospitals, there are 10 times less vaccinated than unvaccinated. So in the ICUs as well, we can see this is the same situation as well. It would be much worse had we not this very high vaccination rate. When we look at Germany, we know that there is a clear relationship between the vaccination rate in a territory and the intensity of the spread of the virus in that territory. So more people are vaccinated, less cases, less severe cases, and less deaths. That's what we can see in Germany and elsewhere. And in the same way in French, we can show that where the vaccination rate is low, for various reasons, that's where we see an incidence ratio and a number of severe cases very high. So the vaccine protects us, protects individuals because it reduces the risk of having a severe form of the disease and being hospitalized, and also slows down the spread of the virus. So it reduces the risk of contaminating, infesting people who might be more vulnerable. And so if you are young, you vaccinate yourself to protect yourself and to protect other people that you meet every day and that may be more vulnerable than you are. So it's a highly protective vaccine, but its efficiency will decrease with time. This is the case with all vaccines, because the vaccine will teach your immunity system to build antibodies. So if the virus comes up, if you come in touch with the virus, you will have weapons and you won't be infected. But after a while, those weapons, the efficiency decreases. The immunity memory is slower. So you need a booster to remind the body to fabricate antibodies. So after a few months, you have to get a booster to reactivate the immunity memory and to multiply the efficiency of the immunity from the very first hours after the booster. It's quite impressive. So people who are vulnerable after a few months reach the optimal protection immediately. So we believe that this is useful to all adults from the age of 18, because even young people see their immunity decreasing after a few months. So the health authorities believe that we shouldn't wait 6 months for the booster. We should have the booster 5 months after the last jab or after an infection. So the HAS, the health authority, just published recommendations, which is what I indicated. And this first announcement is that the booster will be open to all adults above 18 years of age from 5 months after the last jab. So, to all intents and purposes, 25 million Frenchmen are involved. 6 million have received that booster, so 19 million still have to receive a booster, and they are admissible, they are eligible to that booster. And we invite them to get that jab very soon. Some of them may wonder, if I was infected, do I still need a booster? The rule is simple. An infection is the same as a jab. Why? Because if you've been infected, in the same way your immunity system has learned to make antibodies against the virus. And so an infection can give you a protection equivalent to that given by a jab. So this means that if you were infected, you've had a jab, and you are 5 months from your last jab, you should get your booster. If you get a first jab, you got infected, after 5 months, you should get your booster. If you had 2 jabs and you were infected, 5 months on, you should get a booster. It's a clear and simple rule, and it applies to all adults over 18 years of age. At the same time, we want to continue and mobilize the 6 million unvaccinated people. Whatever you may fear, whatever your vaccine hesitancy, there's a French vaccine. You think you haven't enough time to consider. Millions of people were vaccinated. You know, this vaccine is efficient. It protects you. It protects your relatives. So we're going to mobilize all we can do and do all we can do to receive that vaccine. We'll develop campaigns with other people in order to extend the booster campaign in overseas territories, in commercial centers, and I would like to raise the awareness of pharmacists, physicians, nurses to motivate hesitant patients. And I'd like to call upon the most vulnerable of you, the oldest one, who's still hesitating because that virus kills and the booster protects you, the vaccine protects you. We have enough doses, though, to protect those 90 million. We have more than 25 million booster vaccines stored in our facilities, but also at physicians' premises, in pharmacists. The Pfizer, Moderna, over 30 years of age, you can receive a Moderna booster, very efficient. So you can do that with all the health staff, physicians, pharmacies, nurses, masseurs, biology laboratories. All those health professionals can grant as many jabs as they can. There's about 4 million doses in stock being stored in health staff premises. You can also go to vaccination centers. There's more than 1,000 centers over the whole territory. We have one of the best networks in the world, and with local representatives, local maternal care centers, the administrative body system, we're going to open those vaccination centers as early as this weekend, because let me remind you that as of this Saturday, all adults will have access to the booster, and so you can start booking your appointments. So those 90 million Frenchmen can be vaccinated, and in order to be vaccinated, it may take a little time. This is normal. This is a serious discussion. You have to be mobilized, but let me remind you, there's enough doses for everyone, and you can be vaccinated on time. To vaccinate millions of people in a few weeks, it will be quite a feat. It will be difficult in terms of logistics, but we've done it before in spring and summer, thanks to the extraordinary contribution of our health staff and our administrative staff, who I would like to thank again for being so mobilized and to be mobilized again as of this weekend. Now, the vaccination of children 5 to 11. The the EMA will communicate sometime this afternoon and will say that the goal might be accessible under security conditions for kids 5 to 11. What are the stages in France? I will talk to the ethical council, because there are ethical issues in terms of protecting individuals when it comes to kids. And then I would like to rely on the HAS to look in all transparency what data is available to see whether or not and how this vaccination could be accessible to kids. If there was a decision taken along these lines, it would not start before early 2022, because we would need more diluted doses for kids. Now, as regards to the health pass, they have changed. As of the 15th of December, the health pass for the more than 65 will be no longer valid if you haven't received your booster 5 months after your infection or your latest jab. As of the 15th of January, the health pass for all Frenchmen over 18 years of age, it will no longer be valid if you haven't received your booster 5 months after the last jab. So, in other words, once you're 5 months away, you have 2 months to get your booster and keep the benefits of your health pass. Starting Monday, next Monday, PCR tests and antigen tests giving access to the health pass if you're not vaccinated. Currently, they're valid for 72 hours. It used to be 48 hours. Now the virus is spreading a lot more, so we've taken that down to 24 hours. So the valid test is valid only for 24 hours, which means that if you're not vaccinated and if you want to have the benefits of the health pass, you have to be tested every day unless you have serious symptoms recognized by your physician, if you have been recognized as such by the authorities. So vaccination is our best weapon, our best protection. It is an additional weapon, but we must go all the way in fighting COVID. So this is not the only weapon we have. We have preventive measures, masks, and ventilation. Simple measures. Every one of us should comply every day over the long term, and when we see that people are not being as watchful as they used to be. So we have to shape up. Everyone is responsible for the health of the collectivity. We are all in the first line of defense in fighting the virus. So we don't want to saturate ICUs. We want to come back as early as possible to normal conditions of life. Those are small constraints, but that's the key to our freedom. To be free means to be responsible and to be responsible in terms of decisions. Hospitals and ICUs are taking in lots of people who decided not to be vaccinated, who gave in to vaccine hesitancy, who gave in to rumors. They're no longer free. They are no longer free, as I said. I also know that preventive measures seem to be very weak vis-à-vis a virus which we've been fighting for the last couple of years. But these are very powerful weapons in fighting COVID. COVID keeps on spreading. When you have a meeting with friends, it won't stop spreading. And when you shake hands, you will also spread the virus. So you have to be constantly vigilant. You have to go back to those good habits you may have lost. So we see that the virus is all over. We must use a lot of disinfection gel. The mask, we've left it behind, especially among vaccinated people who think they have nothing to fear. And we are looking at a new spread of the virus. We have to put on that mask. So a decree will be taken tomorrow to make mandatory wearing a mask inside. Even in all institutions, you have all venues, public venues, you have to wear that mask. And prefects in all departments will make mandatory the wearing of a mask in events. For instance, over the next few weeks, Christmas sales and antique markets. So here again, the mask will be made mandatory. Ventilation is essential because it evacuates virus particles in suspension. So we should all adopt that reflex to ventilate all the time and everywhere. If a meeting takes more than 1 hour, you should open the window, even if you're cold, for 10 minutes, and it will evacuate virus particles, and it will reduce the risk of infection. Everywhere where it's necessary, it might be set up a CO2 sensor, and it will tell you when you have to ventilate. The other defensive measures, prevention measures, you should use a one-time tissue and so on and so forth. So vaccination, health pass, preventive measures, we have all the weapons to fight that new wave. Over the next few weeks, we'll have an additional weapon. Since the start of the epidemic, laboratories over the world have been looking for efficient treatments. Here again, we've made considerable headway in terms of research. And France is always leading the fight, leading research, and in terms of granting those benefits to patients. For the last few months, we've had an antibody therapy in the form of injections, and so it will avoid severe forms in vulnerable people. Many Frenchmen have received this, but starting with December, we will see a new drug on the market, an antiviral, molnupiravir, will be available. We're very hopeful. It comes as pills. It can be prescribed by GPs. It will be available in pharmacies. It will be reserved to vulnerable people, vulnerable in terms of serious shapes, over 65, or people with severe mobilities. And so physicians will prescribe those pills. And people who are vulnerable and who have symptoms, the symptoms of COVID, if that drug is administered in the first 5 days, clinical studies have shown that can reduce the risk of hospitalization by 2. And it will be the first country in Europe to take those measures. Over the next few months, there will be other antibody or antiviral drugs to strengthen the system. We have weapons, we have resources, we have a toolbox against that fifth wave, vaccines, ventilation tests, and treatments, and we're very hopeful in this. If we mobilize all those tools and if we behave freely and responsibly, we can face up to that new wave without any lockdowns or more serious restrictions. This is what we want. This is also what you want. So let's be mobilized. Let's display solidarity and courage. We've been that way in the past. We should keep it up in the next few weeks. And I'd like to leave the floor to my colleague who will talk about schools.